This conference will now be recorded.
Hello, I'm Lauren Satterwhite, and I'd like to welcome you back to the NC Medicaid EHR Incentive Program for Program Year 2020. As a refresher, this program incentivizes Medicaid providers to meaningfully use electronic health records, or EHRs, in their practice, and the hope is to improve patient care while reducing healthcare costs. If a provider participates in this program for 6 years successfully, they can earn up to $63,750. But each year you attest, there are certain eligibility requirements that need to be met to receive an incentive payment. So this webinar is going to walk through those requirements. In program year 2020, all EPs need a 2015 edition of Certified EHR Technology, aka CERT. And you can check to see if your EHR is certified by going to ONC's Certified Health IT Product List website. Second, you need to meet the Medicaid patient volume, or PV, threshold. So this means for a consecutive 90-day period in either calendar year 2019 or in the 12 months prior to the day you attest, at least 30% of your encounters were with Medicaid patients. The exception would be pediatricians, who can qualify for a reduced payment with 20% Medicaid PV. PV can be based only on your encounters or on the encounters for the entire practice. So you take all the encounters with every provider in the practice, regardless if they are eligible to participate or not. Third is that you meet the 2020 CMS issued meaningful use objectives and clinical quality measures. In program year 2020, all EPs may use a 90-day MU and CQM reporting period. So this means that you must meet the MU objectives and CQMs for a consecutive 90-day period between January 1st, 2020 and December 31st, 2020. And these reporting periods don't have to be the same. They just need to be consecutive 90-day period in calendar year 2020. The MU and CQM data will come directly from your EHR. So you can run a report in your CERT to see if you've met MU in 2020. And if you have any questions on how to do that, please contact your EHR vendor. There are two pieces of past participation information that providers need to be aware of that may affect eligibility. First, you must have successfully attested at least once to AIU or MU by the end of program year 2016 to be able to participate in future program years. We have posted a list of everyone who's previously attested with the NC Medicaid EHR Incentive Program, but has not received all 6 incentive payments. So that's a good starting point if you're not sure if you're eligible to participate or not. Find yourself on that list. This can be found on the Are You Eligible section of our program website. I'll also post a link to that spreadsheet below in the comment section. If a provider is not on this list and the practice or EP is unsure of past participation, email us the NPI of the EP to ncmedicaid.hit@dhhs.nc.gov, and we'll check on our end to see if the provider is eligible to attest in program year 2020. Second, if you switch from the Medicaid EHR Incentive Program to the Medicare EHR Incentive Program, you will not be eligible to participate with our program. Again, if you're not sure if you participated by the end of program year 2016, or if you last tested with Medicaid or Medicare's EHR Incentive Program and your name is not on the aforementioned spreadsheet, send us an email with your last name and NPI and we'll look it up for you. If you are new to the state, we do ask that you send us an email and let us know that as well. For those of you who have determined that you're eligible to attest for program year 2020, I do invite you to watch a roughly 5-minute video which explains how to get started with your attestation and tips to help your attestation go smoothly in program year 2020. A link for that video will also be found below. If you're not sure if you're able to attest now, again, send us an email and we'll try to help you. If you don't meet all of the eligibility requirements this year, we do encourage you to apply next year. Participation years don't need to be consecutive, so if we don't see you in program year 2020, we do hope to see you for the final year in program year 2021. Again, the links and that you've heard in this webinar will be listed below in the comment section. Thanks so much for tuning in today, and please let us know if you have any questions. Our email address, once again, is ncmedicaid.hit@dhhs.nc.gov.